Lifeline Hospital was started in this very same place, but it was an individual house at that time in 1997. Right, so we have been in existence now for about 23 years, and I'm sure you know our chairman. He was supposed to be here, but he's gone out for an emergency. Dr. Rajkumar, a very well-known surgical gastroenterologist. But from that time, we have now, it started as a gastro specialty, but now we have developed into a complete multi-specialty hospital. And some of our expert surgeons are in other fields other than gastro, like Dr. Dinesh in ortho, and we have other surgeons in neuro. We have done some very path-breaking cases in all the other specialties as well. Of course, gastro, we continuously keep setting new frontiers in laparoscopic, and now we've got what is called minimal robotic-assisted surgery, laparoscopic surgery, which is one of the very few in Chennai to have a robot-assisted surgical facilities here. Having said that, about this particular case, Dr. Dinesh is our orthopedic surgeon, one of the orthopedic surgeons, and like I told you earlier, we are developing multiple specialities now here, and we continue to push boundaries and see how we can help our patients. And a lot of patients, of course, you know, are from Chennai and surrounding areas, but we also get a lot of patients from other West Bengal, other states, and other countries also. For instance, Mr. Saiman here is from Bangladesh. He's from Bangladesh, and he's already, what is so different about this case, I will allow Dr. Dinesh to explain more fully, but it was already tried and attempted elsewhere in a big hospital. But he had complications, and then he had to come back, and then, you know, we said we'll take it up as a challenge, and we have managed with the grace of God to give him very good results. And to talk more about this, Dr. Dinesh is our orthopedic surgeon, he's an MBBS MS surgeon. He's a specialist in knee replacements as well as limb lengthening, which is a very, very new technique. It's not a new technique, but the way he does it now is very new. The old one involved what's called Elizarov technique by putting rods and such things outside. But he's got a new method by which it's all done internally, and it's very path-breaking.
So, good afternoon everyone. I'm Dr. Dinesh Chandra, consultant orthopedics in Lifeline Hospital. So, I just want to discuss about a patient over here who's a 20-year-old boy who's come from Bangladesh, and he had initially come to us with complaints of pain and swelling and difficulty walking over his right lower limb. So when he came to us, he was already diagnosed to have something called an osteosarcoma, which is a cancer of the bone and of his right thigh. So this diagnosis was done to him initially at the age of 16 years old. That was 4 years back in Mumbai. And to give you a small idea of how rare osteosarcoma is, you only have about 30 people who are affected with osteosarcoma out of 1 crore people. So it's a very rare disease, and it only constitutes for about 2% of all cancers in the world. So it's a very rare. So it's a very rare, complicated disease, especially involving the bone and the muscle. And as we see him, and when he came to us, he had already been diagnosed to have osteosarcoma 3 times in the past 4 years. So which is extremely rare to occur in this situation. And so let's talking about Mr. Saiman here is when he was diagnosed to have osteosarcoma initially about 4 years back, he underwent 2 different surgeries. One was for his leg at the age of 16 when he underwent replacement of the distal part of the thigh, that is your leg part, and the knee joint itself was completely removed, and a metal knee and a metal bone was put inside, so that the whole cancerous bone was completely removed and changed in Mumbai. But he was also diagnosed to also have the same osteosarcoma for the second time in his lungs. So for that also he had underwent a surgery again in Mumbai a year later. So this is the 3rd time when he came to us. This was, he's been suffering with leg pain, and he's feeling a small movement inside the leg for the past 1.5 years. And because of COVID and all these complications and traveling all the way from Bangladesh was very difficult, so he had to live with the pain for a while. But then the 3rd time when he had underwent a biopsy and he found out that he again has the same cancer for the 3rd time, he immediately came and he found out about us, and he came here for surgery. We had set up a very, very big team of orthopedic surgeons and plastic surgeons, and at the same time we also discussed with our oncologist and a pathologist and a microbiologist. So we had a full big team so that we can give the best treatment for him. And after discussing with the whole team, we had decided and planned that we'll be operating on him and go ahead with this complicated surgery. So why this is such a complicated surgery is because it's being done again for the second time. Usually for these surgeries they use multiple cements. So removing the cement and doing the surgery the second time is much more complicated than doing it for the first time. And so we had to get all the reports done. Once everything was fine, we went for surgery. The most complicated part of the surgery was inside surgery when we saw that he had a lot of fluid inside the legs. So it was extremely rare to find so much of fluid inside the leg. That's the reason he had pain and loosening. So the surgery lasted almost 10 hours for us, and we had to go ahead and remove the cancerous area completely, and that area was filled with the flap cover and a skin graft by the plastic surgery team. We had actually used a very specific implant for this patient, which is actually designed in Chennai, where they have to measure the length of the patient, and we had to specifically make it for the patient, which is another thing which is very rarely done for all cases. Maybe I'd say about one case in every 10 lakh cases which we use this kind of a specific implant, which we had to make it specific for the patient. And the other thing is, when the first operation was done, he was 16 years of age. Now because he is 20 years, he has grown in height. So we had to make sure that he gets a very specific implant so that the height of the patient is also increased. So all these were the very big challenges, and we're actually very happy with the results he's come out through. And he also was discharged in a week after surgery. Just hardly in 6 or 7 days, he was discharged, and he's gone back to his hotel room, and he's been coming and reviewing us for the past 1 week in our OP setup. And now he's planning to go back home to Bangladesh tomorrow actually. So it's been 14 days since the surgery, and he's pretty happy, and he started walking, and he's on his physiotherapy sessions right now. And he's actually trying to go back home soon so that he has to go and write his 12th standard exams, which is coming up next week, which he couldn't write for the past 2 years. So he's very happy, and he's been sitting and studying during his surgery time so that he can go and pass his exam as soon as possible. So that's just a small brief about what we had done with the surgery. So any
surgeries on Mumbai, but I had complications later after the surgery, 1 or 2 years. So we were searching for better replacement or better operation surgeries, etc. So we came here, we talked with others about better options. So we came here and found the doctors. Just after 10 or 12 days, I am going back to Bangladesh after such a major surgery. All thanks to the doctors and the hospital for encouraging me throughout the surgery or treatment. I didn't even realize that it was such a major surgery because they are always encouraging me throughout the treatment. So I was being better day by day. I was feeling better myself, and I am now working. I hope I can be more positive, taking positive vibes from the doctors and hospital. Thank you.
A little bit about anesthesia also.
prolonged tenor surgery.
A little bit about anesthesia also. First, what you asked?
The surgery, I didn't even remember.
So you are fully sleeping and no pain.
I was sleeping, but I think I have some memories of it. I was listening to songs. Yes. I asked doctors to play songs, and I was listening songs during the operation. So it was a small memory, I think.
Nice memory.
Yes, happy memory. Thank you.
You can just say how long it was and why.
First, it was very difficult for him to convince him for regional anesthesia. He was asking for a general anesthesia. So then I told for your procedure, regional is enough. Then we put an epidural catheter and then spinal anesthesia. This combined spinal and epidural. So with that, the procedure went almost 10 hours. So it was very challenging, and he enjoyed that's what he told. interview, listen to songs, and you were just sleeping, so no complaints. It was a good challenging case only.
So, in conclusion, I just want to say that it's been a very, like you said, a challenging one, and it was a full team, a multidisciplinary, not just the orthopedic surgeon, anesthetic, there was a plastic surgeon there was other surgeons. So at least a team of 5-6 together to give a good outcome for this young boy.